Good morning. I'm Phil Ferreira-Lay. I'm a consultant child psychiatrist, adult psychiatrist, and also a psychotherapist by background. I work here in Harley Therapy, focusing on the assessment and treatment of clients who suspect that they might have ADHD. I typically work with young people aged over the age of 16 and then through into adulthood. I really find working with young people and adults interesting. I'm particularly passionate about ADHD, as it is a condition that affects a lot of people. My interest is also sparked by the fact that I have some personal experience, given that my wife and my youngest child have ADHD. I think one particularly important topic for us to consider is the assessment of ADHD. This whole area has come to the fore in recent months because of the high-profile Panorama TV programme, which highlighted, on the one hand, how the assessment of ADHD is a really important thing to do, but that also there might be differences in approach when accessing support in the private sector as opposed to in the NHS. I think the thing most important to say, and it's definitely true of myself and my colleagues here at Harley Therapy, is that we work both in the NHS and in the private sector. And when we're thinking about how we assess for ADHD, we typically apply the same approach in whatever setting we happen to work. This is particularly important because we want to make sure that ADHD assessments are done thoroughly, that they're comprehensive, and that when we're reaching conclusions, that we have a high degree of confidence in the outcome. And that is particularly important because then it's linked to the support that we will often propose to young people and adults on the back of the work that we've done together. So maybe it would be helpful just to say a bit about that process. When we're meeting somebody, when I'm meeting somebody, it's really important that I get a good sense of them as a person and that I have an understanding of the difficulties that have brought them to me, as well as the strengths and coping strategies that they've tried to use thus far to get by. An assessment with me in Harley Therapy is typically done over 2 appointments. The first appointment will last up to 90 minutes, and that will usually be done in person. The second appointment will last about 20 minutes, and that's scheduled a few days or weeks after the initial meeting. And across both meetings, we're trying to do 2 things. We're trying to work out what's going on for the person that's come to meet with me, and then we're trying to identify what the supports might look like. Because when we're undertaking an ADHD assessment, we also need to be thinking about coexisting struggles and difficulties. For example, we know that whether a person receives a diagnosis of ADHD or not, they might be struggling with low mood, anxiety, depression, relationship difficulties. So my assessment of either a young person or an adult is trying to take into account all those elements, because then we can best tailor the support needed in the light of that. So on meeting with me, both in person and then in the follow-up, we're aiming to reach a conclusion. And that conclusion can typically be one of 3 things. It might be that yes, we can confidently diagnose ADHD. It might be that we don't think there's ADHD. We might think that there's a depressive disorder or a personality difficulty that is the root cause of the struggles. The third possibility, which is quite common, is that we might think there's only sufficient evidence for traits of ADHD. And it's important to distinguish between traits and a full diagnosis, because that impacts on the supports that are possible. In essence, and a slight simplification, is that if a diagnosis of ADHD is given, we can both consider psychological supports and medication type approaches in terms of support. However, if we're thinking that we only have sufficient evidence for traits, then we won't be having a conversation around medication. Instead, we will be focusing on approaches such as coaching, counselling, specific forms of therapy such as cognitive behavioural therapy, strategies and approaches to dealing with hypersensitivity to noise and sound, advice around work that could be done in a work context or in a home context. So essentially we're exploring a menu of supports that we might be able to help any person that comes to us. And of course the aim is to try and better establish a good outcome for the person that's come to see us, because people come to us in distress, and our aim through the assessment process and the supports that we can offer is to reduce that level of distress so that the person is able to function better at home, at school, at work, with their friends and with their family. And that links back then to my initial point, which is that whether or not somebody sees me here in the private sector or sees colleagues such as me in the NHS, the issue is about having a good, comprehensive assessment process, irrespective of what setting we are seen. And I'm confident, and I look forward to meeting with you and family members if you decide to book an appointment so that we can explore these issues together.